Ladies and gentlemen, welcome to another special health segment. Today, we're diving into a critical and very important life-saving topic, which is organ donors, in celebration of Organ Donation Month this August. At the George Hospital, we're speaking to a leading expert, Dr. Nellis, that's going to take us through how organ donation works, why it's crucial and important in the context of South Africa, and how you can get involved. So join us as we go through this journey. This episode is brought to you by Ear Pharmacy, your partner in health and wellness.
All right, so my name is Nellis Smith. I'm an emergency medicine physician working at George Hospital. And then also I work in the intensive care unit. This is the only intensive care unit in the Southern Cape. None of the other district hospitals have got ICU. So critical care patients get referred to us and they come in through the front door into EC and then in ICU. So organ donation basically is in the event that someone dies, and there are different types of organ donation, but the main ones is someone that has had a catastrophic either injury or event like a big stroke, and they are declared brain dead. And at that point, the organs are still viable, so they still can be used. And at that point, the question is, would those organs be used for other patients that have got chronic diseases? And there are a whole host of chronic diseases and people on a transplant register waiting for organs. If you think about your organs, there are people waiting for hearts, there are people with lung conditions, there are people with kidney failure that's on chronic dialysis, there are people with liver failure. And then there's also the other question about tissue donation. So there's a difference between organ donation and tissue donation. So there are patients, for instance, that have got severe corneal scarring of the eye, so they can't see. So they'd be eligible for corneal transplant. So patients that have died, their corneas can be used. They use skin, they use bone sometimes for burn wounds patients and so forth. So it's not just confined to organ donations, there's tissue donation. And I think in South Africa, it's not something that is done as much in the first world. I think firstly is the lack of organ donors. And for instance, in some European countries, you are an organ donator unless you specified you didn't want to be one. So you automatically opt in. Yeah. So in South Africa, it's not like that. So in South Africa, there are people that can apply and say, in the event of the following, I would become an organ donor, and they are on that list and so forth. But that's very rare in our setting. I've not come across someone like that. So I guess the biggest barrier to more organ donation is literally just the lack of knowledge about it, and people actually having these conversations beforehand. And there are obviously other barriers, cultural barriers. There are some cultures that it's not acceptable. And beliefs about certain things that people really do not support organ donation. But I think the reality is, if it's a patient that has died, you can potentially save 7 other people's lives by being an organ donor. Well, I think one of the big drivers is putting the word out there. So I think programs like this, where people can talk about Organ Donation Month, and stories about organ donation, and that takes advertisement to get the word out there, just as we advertise for anything else. If people are not aware that is the option. So I think the main driver would be getting the word out, talking about it more. And as I said previously, is that people tend to not talk about it because it hasn't come up in conversations previously. So I think that is probably where we need to focus. Education in schools, primary schools, in hospitals, a lot of different spaces that's available, community centres, community workers, to have a conversation with people so that it becomes something that people discuss beforehand. So what typically would happen is that we would accept a patient. It would either be a patient that comes into the emergency centre or a patient that is elsewhere, had a disastrous event. And as I said previously, probably the two most common ones are head injuries, and they're usually young people, young males involved in trauma, some type of trauma. And the other potential event is people that have got strokes, and they have a catastrophic stroke, and then they become brain dead. So when they are brain dead, there are very strict criteria that we follow to declare someone brain dead. So we want to make sure that that is actually the case, that there's absolutely no function in the brain. That we go, there are two doctors that confirm these findings, and they internationally accepted. So the possibility that someone might still be conscious or still be alive after we've done that test is virtually zero. Yeah. So at that point, the patient is then declared brain dead. And then at that point, we can have the discussion with the family. And in some centres, ours is, we do not have an organ donation team. Like, for instance, if you were in Cape Town, there's an organ donation team that then takes over the process and talks the family through what organ donation is. And as I usually explain to families, there's no good time to talk about that. Because on the one side, I've just told you that your family member has unfortunately passed away. And also I'm explaining that their organs are still alive, which is quite a difficult concept. They're on the ventilator. You can still see the heartbeat on the ventilator. You can see that the patient is potentially breathing, although it's a breathing machine that's breathing for them. So we explain that to the family, and then the conversation is, have you ever thought about organ donation? So the family members, the next of kin, need to be talked through the process, what it is, and would they potentially give consent for organ donation. And that is a difficult process because I think it's oftentimes the family members want to discuss it with other family members and they're not sure. And they need a bit of time to process all these things. So we allow as much time within reason. We can't wait a week, True. But we then allow them time to process and then make a decision for what they feel is best for the family. And I always put it to the family, what do you think your family member that is now brain dead, what do you think they would have wanted? And what do you want for your family? And I think, unfortunately, death comes to all. That's the one sure thing in life is death. And then the knowledge that potentially this life is not just wasted. I mean, a lot of the organ donations that we come across are young people that have been in a car accident or been had some trauma and then unfortunately passed away. And there is some comfort also, and I think the families that have agreed to organ donation find huge comfort then that this life was not just lost, but that the organs live in someone else and they change someone else's life. So from the declaration of brain death, there's a very long process or a lot of work that goes in the back of the scenes. Because we're quite far away from where the organs actually get transplanted, we don't do organ transplants at George Hospital. So what will happen is we need to know a lot of things about the patient, what blood type they are. We do specific type of typing, and they need to find matches for patients. So, and this is all over the country. There's an organ donation register. So people with kidney failure, people with heart failure, lungs, liver failure, and basically they get screened to see, do these organs, would they be able to match some of those recipients. So then we activate the team. Once we know all these things, the team gets activated, and it's not one team. It could be a team from Durban, Johannesburg, Cape Town, all coming together at George. So the patient from George goes to the operating theatre, and from there we wait for the patient actually for the heart to stop, and then the process starts to what we call organ retrieval. So the different organs put in different containers to keep the organs viable, and then from there they get in the plane and they fly as quickly as they can. At that point, when actually the organs are taken out, the recipients in the different areas are already in the operating theatre. Okay. So they're already waiting. Okay. And then the organs get taken to the centre where the organ transplant takes place. We had a great story of one of our patients that it's a patient from Mossel Bay. every week he gets picked up 3 times to come for dialysis. And we managed to get a match for him. And instead of them coming to get him for dialysis, picked him up and said, "You're flying with your kidney to Cape Town to get a transplant." So that was an amazing story. Yeah, look, I think everyone's health is in their same hands, in their own hands. And I think, I think the things that make us not being able to transplant organs is if you're a smoker. That has an impact on your health. It doesn't exclude you from that, but it does impact your health. And the next things are really lifestyle diseases. So we know obesity has got a lot of negative health impacts. And then also together with obesity, we got diabetes, so sugar disease, and that also impacts all your organs. So all those healthy choices that people make in terms of their lifestyle is probably the biggest factor. There are some patients that do have chronic diseases that we are able to transplant. So you think even a patient that is HIV positive, you think you wouldn't transplant this patient, but there are actually HIV positive patients that are waiting for transplants. So you could actually take HIV positive patients, for instance kidneys, and transplant it into another HIV positive patient. So there are some diseases, even some hepatitis, there are still people that we're able to transplant. So I think it's taking care of your own health is probably the best thing. And then probably the next question, how old should you be, or how old are you to not transplant? And look, there isn't a strict time limit because different organs are different. Kidneys, in Europe they have transplanted kidneys from a 70-year-old to other patients. So it really depends on a lot of other things and who you're transplanting it to. So you're transplanting a 70-year-old's kidneys to a 15-year-old is different to transplanting it to 60-year-old, for instance. So there's a lot of factors that come into play about that. But we assess all of the options. Which patients and it's really up to the teams on the other side also to decide. Do we think these organs are transplantable into someone else? Because, the risk that you take is massive. For instance, if you do a heart transplant and the heart doesn't work into another patient, then that is a major problem, as you can imagine. So they're meticulous to make sure organs that are transplanted have got the best possible chance to work in the recipients. So I think for me the comfort is that you could potentially, if you're in that situation, save 7 people's lives. And, we don't often sit in a situation where you're able to save a life. Even in my career, we put plasters on a lot of things, but it's very rare that we can actually save a life. And this is life-changing. I mean, it changes, that person's life, and it's an amazing gift that can be given to someone else. And I think the main thing is to discuss it beforehand, because there is no good time to discuss it when the event has actually happened, with the family. It's really difficult. So to discuss it beforehand, and there's a lot of information available. So there are organizations in South Africa, organ donation. You can just Google organ donation South Africa. There's a register. You can register yourself and make yourself available. And also communicate that to your family and talk to your family. What are your wishes? There's a lot of religious beliefs, cultural beliefs, that needs to be bridged. And if you're that person that feels strongly, I want to donate my organ for the following reason, then your family knows this was your wish. Even though they might disagree, they know that this was your wish. So there's a lot of information available, and I'd encourage everyone to register themselves so that if you're in that situation, your family knows what your wishes were. And there's no greater gift than being able to save someone's life. Yeah.
Doc, thank you so much.
Thank you so much. Thank you for your time.
That was good. It's clear that organ donation is a vital and generous act that can transform lives. We hope this discussion encourages more people to consider becoming donors. For more information, please visit the Organ Donor Foundation of South Africa's website. The segment was brought to you by Ear Coetzee Pharmacy. Remember, your decision today can save lives tomorrow. Stay healthy and informed.